had the exam. Any other questions? I would be taking tests. That's fine. Bring back. Oh, it's that time for me to harass you. Please complete a course evaluation for me. It is very important. This is the only second time I've ever taught this course, and so I want to make it awesome and improve it from what it was that they had done 20 years ago and had never been updated. Also, too, I don't think students realize that 25% of us getting reappointed to continue to teach or promoted comes from student evaluations. So please don't just go down and hit all down Google. I don't care if you say I'm a fire-breathing dragon, whatever. We just need to have that. We need to show documentation that our students have been on an evaluation. I have spent all semester up here for hours talking to you. Please give me 10 minutes of your time to fill out that evaluation. Very much appreciated. All right. I want to start on time so we can do all the cool stuff. Yeah. Okay. All right. So I told you all my announcements that we have here. I have a very special guest today, as I've talked about multiple times. So this is Betsie Poinsett. I've known her since mid-20s, was it?
Yeah. Before COVID.
Yeah, it was like before COVID. So I've done like 6 sessions with her. She's a hypnotherapist. She's going to talk to you all about it. I'm super excited she's here, and then we're going to do some hypnosis later on.
Yeah.
And if you have any questions, if you feel uncomfortable, please leave anytime. So she's perfectly okay with that. So, but it's really cool. It's interesting to learn. So.
Anybody want to leave now? I was going to say hello. Well, I'm Betsie Poinsett. I'm a clinical hypnotherapist, and I promise when this class is over, you won't bark like a dog or cluck like a chicken, okay? That's what's called stage hypnosis. And the man or woman who's up there talking to the audience, he has certain phrases that he says, and he looks around the audience to see who's the most suggestible. They're called somnambulists, because they're the kind of the people that just say, oh, okay. And he calls them up on the stage, and that's why they go under and do all those silly things. It's nothing that I do. I'm a therapist, a clinical hypnotherapist. And so I help people really change patterns and programs in their subconscious mind, which I'm going to show you on this board in just a second. Actually, hypnosis goes back thousands of years. I've even heard that the Egyptians used it in their healing practices. But mostly, you hear of Freud or Mesmer in the 1700s, because actually Mesmer, the word mesmerize comes from Mesmer, who did that. And so it's been well documented and well used for many, many years. Personally, I've been a hypnotherapist for 30 years. I hate to say that. I graduated from a place called the Hypnosis Motivation Institute, and that's in California. Luckily, when I went to school, there was one in Atlanta, so that made it a lot easier. I started out, actually, you know how girls like to go to pajama parties and things? Well, I can remember, like at 8 years old, hypnotizing all my friends. So when I heard about hypnotherapy, I said, I think I can do that. And so I did. I went to HMI, as I said, in Atlanta, got over like 600 hours of training. The main reason I really went is because my son was diagnosed with ADD, the famous ADHD, whatever. And I was trying to find an alternative to Ritalin, or any medications, actually. And hypnosis was really great for it because it helps kids focus. It helps retain information. And it also, when they act out with their behavior, it helps get them to not do that so much. And so I was thinking today, with you all doing your graduation soon and having to take these exams, when we do the end hypnosis today, I was going to ask you to think of something you really wanted to improve on. And I help many people pass exams, all kinds of exams, real estate exams, GED, nursing exams. And so if that's what you want to work on today in the hypnosis section, you can just think about actually having instant recall, instant recall, instant recall. Now, the catch to me helping people with exams or any studies is you do have to study. It has to be in your mind. I can't just say, oh, you're gonna have a great score if you haven't studied. So you do have to do that. I guess the next thing I should do is my famous drawing here. It's called The Theory of the Mind. And this is how HMI has helped us understand how the mind works, and you learn and you absorb information. I tell you that because I don't want you to think I just made it up. You know, this is their theory. So I'm going to draw a big circle here and just pretend this is your mind when you're born. And everything you're told between the ages of 0 and 8 goes right into the subconscious. You have positive things that happen and you have negative things that happen. These really form our beliefs about ourselves for the rest of our lives. It's mainly why adults come and see me because, let's face it, I mean, not everybody had a great childhood. I have to do a lot of inner child healing work with people. Then at about the age of 8 to 13, this is when a filter comes across. Thank God this filter is here. It's called your critical mind filter. And this is when you start censoring, evaluating, and analyzing all the information that comes in. If we didn't have that filter, we'd be in the loony bin. I mean, really, we'd just be in la-la land all the time. This is also when our conscious mind is fully developed. Now, the conscious mind is where our logic and our reasoning is, which equals willpower, which is usually that thing we never have when we need it, right? And that's because the subconscious mind, here's my other little marker, there it is 88% of our mind power, and the conscious mind is only 12%. So you can see what a big pull the subconscious mind has. The way we develop habits and patterns, anything we do over 21 times, that becomes a known to the subconscious. And so that's how we develop all our patterns. If you do something a couple of times, you know, you can throw it out, doesn't matter. But over and over, that repetition is what happens to really solidify things in the subconscious mind. Also, when you try to change something on your own, I don't know, let's just say lose weight, everybody wants to lose weight, so or go on a diet. Your conscious mind with your logic and your reasoning says, yeah, you can do it, you can lose weight. Well, that idea has to filter down here, right through the critical mind filter. And it's just like Googling on a computer. And it searches it out and it says, well, what have you done in the past about that? Well, if you've been successful and done it over 21 times, then that's no problem. It just helps you lose weight. But if you haven't done that and you continue to, lose weight, gain weight, lose weight, gain weight, then that's kind of a pattern for people. So it just says, nope, I don't want her to lose weight, him to lose weight, forget it. So the subconscious mind is afraid of the unknown. And so it doesn't like change. That's why it's so hard for us to change. So what hypnosis does is, first of all, I talk to my clients. I talk to them 40 minutes, whatever they need. We make a plan of whatever it is they're trying to change. And then I have them sit in a recliner chair and they just kind of close their eyes, and I just do these deepening techniques to help them go deeper and deeper. And what that's doing is opening a pathway here in this critical mind filter. So they're not censoring, evaluating, and analyzing this new information. And I can actually bring it down here and take the negatives and turn them into positives. It gets the 88% working with the 12% to give you 100% of your mind power working together to make the change. And once I found that out, I said, I want to do that for everybody, because trying to change things on your own is like, 88 horses pulling against 12 horses and hitting your head up against the wall. And this is so much easier. And that's why later I'm going to do this hypnosis, and then I'm going to teach you self-hypnosis also, so that you can do that on your own. And it's very effective. Any questions so far? Okay, let's see. I'm like a detective. I have to listen to what the person's saying, and I have to figure it all out. At HMI, they teach us that people are either more left-brained or right-brained. We don't want to be 100% left-brained or right-brained, but we want to be kind of in the middle. So that we have a little questionnaire that we give people that will help you understand, if you're more left-brained or right-brained. Right-brained people, they happen to call physicals, and they call the left-brained person emotionals, which is kind of confusing because the emotional is actually the person who is, or left brain is more like your computer expert. They like numbers, they like to crunch numbers, they're more inward drawn. The right brain person or the physical, they're more outgoing, they say, oh man, let's just do this. If it works, let's do it. The left brain person for hypnosis is kind of saying, why? Yeah, they're a harder client actually. And I actually have a little exercise I want you to do to see if you're more left-brained or right-brained. And if you would just stand up for a minute, I've got a little arm exercise we can do. And this will get you to see exactly how much left-brained and right-brained you are. Good, so all you have to do is put your arms out like this. Good, and just close your eyes. And then as you close your eyes on your right wrist, I want you to imagine you're tying like a balloon around your right wrist. And then on your left, I want you to just imagine like you're putting a book there, something heavy. And then I want you to just start imagining that the right arm is lifting up and the left one's going down. And the right one's going up and the left one's going down. The right one's getting lighter and lighter and lighter. And the left one's getting heavier and heavier and heavier. You get lighter, lighter, and heavier. Lighter and heavier. Okay, now just leave your hands where they are and open your eyes and see where your arms are. And so you see you're more in the middle there, which is good. There's no right or wrong. You're more right-brained. How about you? Yeah. And how are we doing? And a lot of you are right in the middle, which is very good. Yeah, thank you. Have a seat. And that just shows, and I've got this little questionnaire you can fill out at the end and take it back with you, because that will give you your exact percentage of whether you're more left-brained or right-brained. Like I said, you don't want to be completely right-brained or completely left-brained. So actually balanced in the middle, 50-50 is ideal. And it's just nice that you could do that. A lot of you were very balanced. Let's see, I'm looking at my notes here. I don't want to miss anything. When I have the people come in for sessions, usually the first thing they say to me is, we've tried everything else. We've tried it all. And maybe hypnosis will help us, So I say, okay, gee, thanks. No pressure here. I never know what I'm going to be getting into. I was going to go through a bunch of my cases that I've worked on for the medical community. I was thinking when I went to HMI, usually after you graduate, you have to be there a year before they'll put you on staff. And I don't know, I was just wonderful, I guess, but they put me on staff within 6 months. And it was just such a thrill to be able to have that honor. Well, one day the director was going on vacation and he asked me to take all his cases over. I was really scared, I thought, oh my God, okay, I'll do it, So one of the cases he gave me was helping this woman that was going to go in for surgery. And I work on a lot of cases with anesthesia, having really great results coming out fast. So what she wanted was that I forget what kind of surgery, it was some not a very serious surgery, like outpatient. And what she wanted was that when she got out in recovery and out of anesthesia, as soon as she heard her boyfriend's voice, she wanted to wake up and be fine. She says, I don't want to have any problems. So I did that. I told her under hypnosis that she was going to wake right up and not have any problems. So I she went on her way, and then about a couple of weeks later, she came back to the clinic to get another session with the director. And I asked her, I said, well, how did it go? And she said, well, I was in the recovery room and I was out of it, and I heard my boyfriend's voice, and I sat right up on the bed and said, okay, I'm ready to go home now. And I said, well, I'm glad that worked, but that was so funny. I'll never, ever forget that. I also worked on a heart bypass surgery, aorta replacement. And one of my clients that I was seeing for a long time was having this surgery, and she was having they do a pig valve now for replacement. So she was doing that, and you can't just really go in and have someone come in for one session and have that be effective. I worked on her for about 2 months to be able to really accept this surgery. And that's what we worked on, that her body was going to easily accept it, and it was going to be a perfect surgery, and everything was just going to go great. And when she woke up, I said, same thing kind of with that other lady. I said, you're going to get up, you're going to be fine, you're going to have hardly any pain. And we worked on that, like I said, for about 2 months. And so she went in and had the surgery, and it was so successful. It was so fantastic, because I didn't know this, but when they go in for surgery like that, apparently, like the surgeon does a couple, he has like 5 in a row or 6 people in a row that he's done, boom, boom, boom. And so all the beds are there, and all the people are laying there trying to come out of anesthesia. And all of a sudden, she came out. She sat up in bed, and there was a chair right next to her bed. She just got out and sat in the chair and had a big smile on her face and had no pain at all. All the other people were still out. I mean, they were still trying to, and they were moaning and groaning and all this stuff. And she said the doctors and the nurses really couldn't believe that she had such success. As a matter of fact, her sister-in-law was a nurse, and she came to kind of have special care of her that day, and she couldn't believe it. She couldn't believe that she had such great results. So it's so rewarding to help people have these things. The other, well, I was going to tell you about epigenetics. I think you did some work with epigenetics later, didn't you?
Yeah, they've done epidemiology. A bunch of them have taken genetics, right? Or had to.
Oh, yeah. Well, this is kind of a different subject, I think, but I couldn't believe this happened. I was listening to Joel Osteen one morning. Do you all know who he is? I really like Joel Osteen. So I'm listening to him. There's all these people. I mean, how many 5,000 people in his church? And he starts talking about epigenetics. Well, I had never heard the word before. And so my ears, I'm like, oh my gosh, what is this? Well, he was telling his congregation that just because your parents were depressed or abusive or terrible to you, it does not mean that you have to propagate that. You do not have to follow in their way. And he said, you have the power in your mind to change it. And of course I said, yes, yes, yes. And I just thought it was fabulous that he was talking about this and giving people that information that you really can change your mind. Well, that was fine. Well, then a couple of days later, I was visiting a friend of mine who happened to be on the transplant team at Emory University. And so I was telling her about this. And she knows me really well. She's rolling her eyes like, there goes Betsie again. She's telling me something that woo-woo stuff that I don't even understand. And I said, okay, well, this is what I heard, and I think it's a great thing, because that is what hypnosis does, actually. Well, she emailed me in a couple of days. She said, you'll never believe this. She said, the surgeons that are on the transplant team put out a newsletter every week. And after you left, I got their newsletter. She said, guess what it was about? epigenetics. And I said, see, I'm not so crazy after all. So that's really what I really try to help people understand, especially in the medical community. It's our words are so powerful. Our thoughts are so powerful. It's like, do you want to think positive things or negative things? It's called self-talk. When you talk to yourself, positive or negative. And when people are in, especially with doctors and medical people, people look at doctors like gods. They think, oh, whatever they say, that's true, that's true. And that's what's so fabulous that you're doing these alternative things to help people understand that you can do alternative work. And so it's really wonderful if you can get a surgeon or a team, like if they're going in for surgery, just imagine if the surgeon is standing there and he opens somebody up, let's just say for lung cancer, and he looks at him and he goes, oh my God, there's no hope for this person, and do you know your subconscious mind hears every single thing when you're under anesthesia? And so it's really important to be saying positive things. I know some teams that really do stand over a patient in surgery and they'll pray for them. The whole team will stand around, hold hands, and say positive things. It really helps the recovery so much faster. I have like a little exercise I want to do. Can I have a volunteer to so I can show how the mind works with positive and negative thoughts? Come on.
Sure.
Okay, come on up.
Hey.
Okay. And what's your name?
Ella.
Ella, hi. Okay, just stand and face everybody. Now, which is, move up a little. There we go. So tell me, which is your dominant arm?
My right.
Okay, so I want you to put it out just like that. No, sorry, right there. And just close your eyes and think of your name and show me how strong your arm is. See how strong your arm is, and you just think of your name? Good, now just relax it. Just relax your arm. You're already hypnotized. Okay, now what we're going to do is I want you to put your arm up just like that again. Then I want you to think of something really just wonderful, fabulous thing that this would keep you really up and strong. Okay, and then let me see if I can move your arm. See how strong your arm is? Okay, now release it again. And now let's put your arm up one more time. And I want you to just think of something really sad, just something really just a real downer. Okay? Yeah, was it that? So can you see the difference?
Yeah.
I know. Okay. Thank you. So that's what's so interesting about how the mind works. This is called kinesiology, where you can actually do muscle testing for people. You can look it up on Google or whatever. There's so much you could do. Some people go like this. They put their thumb and their first finger together to strengthen it. And then if they want to get a yes, it's real hard. But a no is like that. You can like go to the vitamin store and stand in front of a bunch of vitamins and say, is this the one for me? No, no, no. I mean, people would save a lot of money if they did that. Okay, let's see here. Chemo, oh boy. Oh, chemo. I help a lot of people come out of chemo without any side effects, without any pain, and they almost like coming out of anesthesia. It's really amazing. As a matter of fact, I'm working on a client right now who she's really having a tough time with a cancer diagnosis. And when she went in for her very first chemo, and I don't know if you know this or not, but I didn't know it, but the chemo itself sometimes makes you have neuropathy in your feet, and you get numbness in your feet, and they're real cold, and it's like walking on marshmallows. I guess it's really sad. I know several people that's happened to, and she came to see me after this is like her third round of chemo. So she said she hasn't been able to feel her feet for a year, and they're cold all the time. So At the end of the session, I was helping her with the chemo and not having any more side effects. And at the end of the session, after she's sitting in the recliner chair, I said, let's just look at the chemo for a second and go back to the very first time that you had a treatment and how it affected the nerves in your feet and to have this problem. I said, let's just see those nerves healing back together again and your feet getting warmer and warmer. And, I do these things, it's almost like an experiment. It's like, well, let's just see if it's going to work. Why not try it? So I do. Anyway, she gets up out of the chair. She's ready to leave. Betsie, I can feel my feet. They're warm. She said, I can't believe it. And I couldn't believe it either, really. I'm so thrilled for my clients when these things happen. And that poor lady, like I said, she's had to put heating pads on her feet. They've been so cold. And in one session, it's like you can talk to the body. The body wants to hear our commands. And so those nerve endings all went back together again. I mean, it's just really wonderful. And then we get to COPD. Oh boy. You all know what that is, I'm sure. COPD. And that's a really good time to talk about deep breathing, because one of the first things I do in a session is teach people about deep breathing. Do you all know about diaphragm breathing and how to use it? Because it's really a lifesaver. As a matter of fact, I had a client who was coming to me to stop smoking. I've even had some clients come to me to stop smoking with the thing in their neck, the throat, just on oxygen. I mean, that's what I say. They come to me and say, I've tried everything else. I go, thanks a lot. And quite honestly, those people don't stop smoking. They really don't, because, they really feel like they're going to die soon. And they think, why should I stop now? So I just help them relax. But back to the breathing. When you do that deep breathing, of course, it gets the oxygen all the way down to the bottom of your lungs. And that sets up a natural relaxation response for the whole body. You can't have stress and relaxation coexist in your body at the same time. So once you start doing the deep breathing, it really trains your body to relax. I was thinking about this lady that came to me to stop smoking, and she was going to a place, and you probably know better than I do what it is, but they have to breathe into a machine, and what is that called? You breathe into the machine, and it tells you your level of oxygen or something. And oh, there you go. That's right. And apparently, every time she went, her levels were really low. They were really worried about her. So I told her about the deep breathing strictly for hypnosis. We never talked about that machine. We never really did any work on that at all. But when she went back for her next session there, she said, Betsie, I remember what you said about deep breathing. So I just did that into the spirometer thing, and I have these really high levels. And she said they couldn't believe it. They just couldn't believe it. So that was really a good lesson for me to understand, why all these techniques are so important. Everything we do helps the body. Also, lowering blood pressure. Wow. I mean, what's a good blood pressure? 80 over 120? Is that, I don't even know.
120 over 80.
Oh, 120 over 80.
You got it.
See that? I got it backwards. Well, you can actually talk to your body. I think there's some kind of a problem when you go to a doctor. Is it called the white coat fear? When as soon as you know you're going, your blood pressure raises. So you can actually be talking to your body as 120 over 80, 120 over 80, and over again, just to get that into your mind. And I've done it myself. And I go to the doctor and it's 120 over 80, and I go, thank you. I appreciate that a lot, So that's a really good thing to talk to your body about. Speaking of talking to your body, did you know that 30 minutes before you go to sleep at night, you're the most suggestible? And that's the time to really study, think good thoughts, think those positive thoughts, think about anything that you'd like to change. And then that's what the subconscious mind works on all night long. The subconscious mind always wants to help us, and it's always trying to think of ways to help us. And the other part about that is like talking to an 8-year-old child. So anytime that you want to really make a change in your life, if you talk to yourself right before you go to sleep, some people like to journal, and you can do that right before you go to sleep. Well, along with that, then the dreams we have at night are like the 4 o'clock in the morning on, or the dreams that you have just before you wake up are called our venting dreams. And sometimes we have really bad dreams then, oh my God, the world's gonna end or something horrible's gonna happen. And say, no, 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 that's not what it is. It's what the subconscious mind is working on to try to release and let go of. So it's really a good thing. Say, thank you, keep going, keep going. I don't want to hold that in my mind anymore. So remember that about the 30 minutes, and then the venting dreams are really what the subconscious is trying to help you get rid of. I talked about the power of words, and we did that demonstration. It's also really good to play soothing music when people are in surgery and say those powerful words. I just can't emphasize enough the power of our words. Even talking, like even this morning, when I got up, I said, I'm going to have a great day today. Everything's going to be wonderful. I'm going to have a good lecture here. And that sets up the day. Instead of getting up and, I'm tired. I don't want to do anything. It's really amazing to do that. Let's see here. I've got suicide. Oh boy. I've worked on a couple of cases, especially young people who want, to kill themselves. And that's such a sad thing. And their parents have sent them to me for me to help them understand they don't, they're worth something. It's about your self-worth too. Of course, the ones I worked on, it was because they'd had a bad breakup with a boyfriend or a girlfriend. And I understand that that's pretty devastating, but what I do for them is I do what's called a future projection. And that is to take them into hypnosis, have them feel better, and say, okay, we talk about this first. It's like, what do you want to do? What kind of career do you want? And this one client wanted to be an architect. He wanted to go to Georgia Tech and be an architect. So that's what I had him see in hypnosis. See this future that you're going to do. And I worked on him several times, and he did get a lot better. He was fine. He was fine after that. And then I learned later that he actually did go to Georgia Tech, and now he is an architect. So it's amazing how the mind can project these things. I love it. It's really good. I did talk about exams and tests. And I've gone to North Georgia Tech to help people with all the exams there. There was a real estate class. And half the class couldn't pass the real estate exam. So they called me in to hypnotize those people so that they could have the answers. Like I told you earlier, it has to be in your brain. So I did that, and then they all did pass the real estate exams. Okay, that's a good one. Bar exams, GED. I love to help kids pass their GEDs because you at least have to have that. At least, before you go on to do anything else. Also, I talked about that 8-year-old child there and how a lot of problems are from childhood. And in all the work I've done, I really believe that's where addictions come from. Mainly because there's still this little child stuck back in a situation that is hurt or wounded. I call it inner child healing. And usually I have to do that in the first session, honestly, because what happens is, as an adult, we get older, we get wiser, and there could be this little child back there that's still hurt or wounded or wasn't listened to. And so we get a little further ahead, and then all of a sudden people might start to sabotage themselves and they don't go forward. And it's usually because there's this little child back there going, oh, wait a minute, you can't go on any further because I'm still back there hurt and wounded. So I do it in hypnosis. I do like this ceremony where I have them rescue that child. I call it the inner child rescue. And it's like putting a puzzle piece back together for the person. And then it's amazing to see the progress they make from that. I really think it's important. And that kind of goes along with something called the hero's journey. There was a man named, his name just went out of my head. Boy, that's good. Anyway, Joseph Campbell, that's his name. He wrote a book and he coined the phrase the dark night of the soul or follow your bliss. Have you heard of any of those terms? Well, follow your bliss is a pretty powerful and popular phrase because that means that you follow your bliss. They say, find out what you love to do, what you really love to do. And I think that's why you're studying all these different things, is to find out what you really love to do. And you're in the medical community, so that's really good too. But if we're following our bliss, then it's like we're doing what we really love to do instead of some drudgery job, that's really a downer. And that means that you're not going to be as successful. It's kind of like that. You lose interest in it, but following your bliss is fabulous. Joseph Campbell also coined a phrase called the dark night of the soul. Now that is not to do with your bliss at all, but the dark night of the soul is when people really get into bad situations. They get depressed, they get lethargic, they just want to give up on life. And so that's what's so important, is how are you going to get out of that? That's the challenge. You're either going to wallow in the muck and become a victim, or you're going to move forward and grow and learn fabulous things. That's what I call the spiritual journey, where you start really understanding all these wonderful spiritual things or positive things. There's really great books out there, things on, of course, the internet, that you can find out how to move forward in your life. Because I think that most dark nights of the soul, when you get into that victim mentality, well, people like that, where everything's just always bad and it's always not good. And that, talk about negative self-talk, that's really a spiral that goes down. I'd rather have a spiral that goes up. So that's just my little pep talk for today. I call it a toolbox. I ask my clients to get a toolbox of what can they do if they feel bad? Can you pray? Can you, I like angels and guides, really. I love to talk to angels and guides. Everyone has a guardian angel, and I've called them in all the time to help with my clients. It's amazing the results I've seen. But have a toolbox, like maybe a favorite Bible verse or a prayer that you like to say, some way that you say, okay, I'm not feeling really good right now, but let me open my toolbox and pull something out, talk to a friend, take a bath, send your kids away, whatever. So that is about what I recommend. Are there any questions? All right, you all got it, huh? All right, good. Now, I'm going to take you through self-hypnosis, and then we're going to do a regular hypnosis. And what self-hypnosis is, it's more of a formula. It's something that you would do yourself without a therapist talking to you. And that way, you're in control, obviously. And like I said in the beginning, it's really good to think of something positive that you want to work on. You can do that today, or you could do it later. But while we're in the self-hypnosis, I'm going to take you through that. and then we'll do the hypnosis, and you'll have really a good chance with both of them to have your needs met. Let's talk about in the self-hypnosis. They call it the 3-key approach. And also it's called the law of repetition and the law of association. When you are going to, I don't care, pray, if you're going to meditate, if you're going to take time to yourself for improvement, it's really good to do it 21 times. You really need to do it over and over again to get the subconscious mind to go along with you. And the law of association means that it would be good to do it at the same time of day. It would be good to do it in the same chair, because that tells the subconscious mind that's association. I'm associating. When you sit down at 10 o'clock in the morning and sit in the same chair, oh, okay, let's do this self-hypnosis now. I talked about deep breathing. We already know how to do the deep breathing because I always start that way, and we talk about what you want to work on. So let's get started then.
Can you do just a couple examples of deep breathing?
Oh, sure. Well,
because I really, that's something I really struggle with.
Oh, okay.
It takes me a while.
Oh, I asked if you knew about it, so I thought they did. Sorry. Well, really, most people do shallow breathing, and especially if you get scared or stressed out, or they won't breathe at all. And that causes more stress in the body. So what we want to do is bring the oxygen in for like a count of 5, all the way down to the bottom of your lungs. And then just hold it for a few seconds and let it out. Let it out. And you do that a couple times, and you can really, really let your body, feel your body relaxing. You can do that anytime, whether it's hypnosis or not. Anytime, especially right before a test. I always suggest that before a test. Take a deep breath, hold it, let it out. Usually 3 or 4 times. Everybody understand? Good, you're relaxed. Good, good. All right, so uncross your legs. Put your feet on the floor. And just arms on your thighs if you want to, on the table, whatever, as long as you're comfortable. And then just close your eyes. Close your eyes. And I want you to just take those 3 deep breaths down. Just letting that oxygen go all the way down to the bottom of your lungs. Hold it for a few seconds. Letting it out. Thinking calm, relaxed, calm, relaxed. And as you get more and more relaxed with that, good. And then the next part of this self-hypnosis is that you focus your attention from your toes to your knees. Just think about your toes to your knees becoming relaxed. And it's called 3 keys because the first key is, at this point, you're just going to think of the word tingling or floating, whichever word you like best, between your toes and your knees. And as you get used to that feeling, then the second key is you bring your attention up to your chest. And again, you can do some deep breathing if you want to. And as you do that breathing, you think of the word calm, calm, calm. And then the third key is you bring your attention up to your head. And you think about your eyes, just relaxing your eyes and your mouth. And as you think of that area in your head, you just say the words, deep sleep, deep sleep. Experiencing a state of complete relaxation. Thinking about your eyes just kind of rolling up under your eyelids. And so you have the three keys from your knees to your toes to your knees, thinking of tingling or floating. Your chest, thinking calm, calm. And your head, thinking of deep sleep, deep sleep. Rolling your eyes up under your eyelids. And this is the time when you would do that visualizing for whatever it is you want help with, or to feel good about, or change, whatever that is. Now take a few moments in the silence now just to do that for yourselves. And if you're doing this by yourself sometime, you can take as long as you need to be visualizing this positive outcome. And as you think about that positive outcome, then you start to think about a 20-step staircase. Easy steps to come down. And you stand at the top of those steps with your left hand on the handrail. And all of a sudden, you'll just start coming down the steps with your right foot first at 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and 0. And this is really putting that idea deep into your subconscious mind so it can be working on it. And then we come out. And the way we come out of any hypnosis is that we start by saying 0, then 1, 2, 3, 4, and 5. Eyes open, wide awake, wide awake. And that's self-hypnosis. Everybody more relaxed now? Good. All right. Now I'm going to do the hypnotherapy that I do in my office for people. And it's just the same, really, except I'll be just talking to you again. And it's a different kind of, you'll see, it's real good. It's real relaxing. And so the same thing is, we put our feet on the floor and just get in the same position you were in. Good. And again, we start by taking 3 really deep, deep breaths. Letting that oxygen just go all the way down to the bottom of your lungs. Knowing that deep breathing sets up that natural relaxation response for the whole body. Sending a signal to each and every cell. It's time. It's time to relax. It's time to let go. Just getting yourself out of the way to enjoy the process. Knowing that each breath is as important as another. Creating a cycle, a circle, a whole, reminding you of balance. And of that deeper place within you that continues to strive towards balance and peace, serenity. And to go even deeper again, we bring your focus of attention all the way down to your toes. Just thinking about your toes for a moment. Think about them relaxing. And as the toes relax, then the heels and the ankles relax. Letting your feet relax. Your calves, knees, thighs, relaxing. Moving into your hips, soothing and saturating. Relaxing the muscles in your lower back, up and down your back. Into your shoulders. Letting go of any tensions there in your shoulder area. Imagining just putting a cape of relaxation across your back, soothing that whole area. Then bringing that relaxation up through the back of your neck, base of your skull, relaxing. Top of your head, melting down over your forehead, your eyes, your nose, your mouth, your jaw, relaxing, letting your whole body just relax. Moving down through your arms, elbows, wrists, hands, fingers. Now, at the ends of your fingers, just imagine or pretend that you have little faucets, little valves there at the ends of your fingers. These are really important because you can open them up, and as you do, you can release tensions, anxieties, resistance, overload, stress. They're really great to just let all that go out into the darkness of the night sky, the stars, the universe, the void, the heavens. That safe void which is accepting of all things, drifting, floating, melting. Now in a few moments, I'll be counting backwards from 5 to 0. And with each count backwards, you can just be entering that hypnotic sleep more deeply as we reach 0. The first at 5, the tendency is again for a little deeper breath, a little more oxygen. 4, the eyes roll gently up under the eyelids. 3, 2, 1, and 0. Going even deeper, knowing each time, every time I say deep sleep, you're sleeping soundly, deeply, and completely as the physical body relaxes. Because this is a natural venting process, a natural healing process, and a natural learning process, where we access the subconscious mind, that 88% of your mind power, because it always wants to help you. As I said, just it loves to help, and it's like talking to an 8-year-old child. So it needs to know what you need help with, what you'd like to stay with, what you'd like to start new patterns with. And so to do that is when right now you would put in that new idea, that help that you wanted, that you used in self-hypnosis. So you could use that right now and for a few moments in the silence, just thinking of positive things you'd like the subconscious mind to help you with. And then we always thank the subconscious mind. Say, thank you, thank you, thank you for helping me with this problem. And then it's time to wake up again. But before we wake up, we go to that 20-step staircase again and stand at the top of it. And this time, as we stand at the top of that staircase, again, you say thank you to the subconscious mind. You imagine that whatever you wanted, whatever you were trying to get help with, is as if it is done, as if it has already been helped. Have a big smile on your face, thinking, great, great, thank you. Bringing this new positive image down the staircase. And with each step down, it can become more deeply absorbed into every area of your subconscious mind. Starting with your left foot at 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and 0. Taking it with you into your everyday life, thinking it, living it, being it, doing it, demanding it of yourself because you deserve it. And now at 1, we start to come up a little more. 2, 3, a little more oxygen in the mind, the body, and the spirit. 4, lighter and lighter. And now 5, 5. Eyes open, wide awake, wide awake. Good, very good. Yes. Now, I want you to understand why I count up 0 to 5 and say eyes open, wide awake. What that's doing, well, first of all, in hypnosis, we're opening that pathway right there between the conscious and the subconscious mind. And so that means you're wide open, wide open. So when I count up 5 and say eyes open, wide awake, we're closing that pathway. And the reason we're closing that pathway is because if that stays open, that's when we're just kind of like our eyes are glazed over. Did you ever get really overloaded and just feel like you couldn't handle another thing? It's the same thing as watching a movie. Watching a movie is hypnosis. You know you're watching a movie. You see the characters and the actors on the screen, but you're all of a sudden you're sucked into it. Well, that's opening that pathway. That's all it's doing. So if you feel like you're really getting, you need to focus more and get more alert. Sometimes I can feel myself just getting into that feeling, and I know I'll just drive down the road or talk and say 0, 1, 2, 3, 4, 5, eyes open, wide awake, wide awake, and all of a sudden you're back to probably how you feel right now. You're more alert. So it's really an important aspect. Any questions about that? No? Okay. I didn't really talk about HMI enough because Hypnosis Motivation Institute, where I graduated from, they have a wonderful program. If you're looking for some alternative ways in the medical community, they actually have a fabulous online course. And they're the only college of hypnotherapy in the United States. And their training is excellent. So I really highly recommend it. And they have hundreds of videos and things that you can study from, and then a lot of online stuff. It's really fascinating if you're into the mind. Now, I have this questionnaire here, and I think we have time actually to fill it out now. I've got a couple handouts. This is a little sheet I have called The Theory of the Mind, which was that. And it just talks about this conscious and the subconscious, and it's a little chart there numbered from 1 to 21. So if you want to make copies of it, any goals you have, you can check off each day that you've done it. So that's the first handout. And then this is the questionnaire. Now, there's questionnaire 1 and there's questionnaire 2. So if you want to go ahead and do that now or save it for later, it's fine with me. But this is the sheet that we score it on, where we'll get the definite percentages. So let's see here. You just take that. I was going to be passing on, but I guess I'm going to deal with it. All right. And why don't you just take one of the 3 sheets and pass it around? Did you have anything you wanted to add? Yes.
Always.
Okay, go ahead.
So, as someone, as obviously most of these students, they want to do healthcare and medical professions. So they're learning more obviously about medical management and that the typical allopathic care, not so much on the holistic side. So, do you have any advice for them as far as how to recognize like not patients that hey, this might work for you? Because like with me, I have really bad cervical stenosis and bulging disc, and I went to a neurosurgeon multiple times, and physical therapy wasn't working for me, and he literally was like, let's try acupuncture.
Yeah.
Would you like to do this instead?
Good.
And I never would have thought about doing that had that neurosurgeon who you would think would want to do surgery and loves doing surgery and wants the money from surgery.
Right.
But he knew I wasn't a good candidate for
Yeah.
that. So do you have any advice to them as they go into the medical professional as to kind of signs to look for patients maybe that maybe medical management or allopathic care would be for them?
Sure. Well, knowledge is freedom, and that's so, it's great that you're introducing all of these different things, because then all of a sudden, if they have somebody with a cervical problem, they can say acupuncture. There's mainly, like I said, when people come to me, they say, I've tried everything else. And that's the sad part. You have to really get versed in alternative ways. I mean, there's even healing. There's Reiki. Have you ever heard of Reiki healing?
Yeah, we did.
Oh, good.
Yeah.
That's fabulous. And sound healing. It's like that lady that I had with the neuropathy on her feet. She had so many CAT scans and things, and she was looking for alternative healing. And one of my clients told me about this clinic near Athens called the Mayberry Clinic, where they actually did all kinds of alternative healing things for people with cancer. So I gave her the information, and actually just yesterday, she texted me and said it has saved her life. She said that has helped me so much. It's exactly, she was looking for an alternative, and she said, this is exactly what I needed. So it's like our toolbox I was talking about earlier. It's almost like when you're in this profession, you need a toolbox of all the different modalities, and say, okay, what does this person need? What does that person? Because everybody's so individual. Even, essential oils, like you said. And, does that help? I don't know if it answers your question, but it just depends on the person. Because allopathic takes, I think the biggest thing that's needed in the medical community right now is a combination of allopathic and Eastern philosophies of all of that. Chinese medicine is fabulous. So just exploring, and looking at all these different things. I hope that answers your question.
I think it did.
Oh, good.
And also too, I'm just a little classroom. Like, what are your specialties? Like, like that you like to focus on for your patients? Like, anxiety. Like, basically, what patient? I know you talked about CEOs at one point. Me and you have talked about that.
Yeah.
So, like, what? Basically, like addiction. Is it yours? That is it anxiety? Is it inner childhood trauma? Like, what do you focus on the most?
All those things you just mentioned. Really.
Is there anything?
I know. Well. Almost all my calls I get are for anxiety. We are living in such an anxious time right now. The whole world's gone crazy. And that's another reason to have a toolbox to say, okay, you need to find out what works for you. That I say everyone has their own religion inside of them. I know I have to go out in nature and sit by a lake in order to get my focus back. Grounding is what they call it. And I don't know, everybody has to find their own way. And it's really, really important. I work on a lot of CEOs. I work on CEOs for multi-million-dollar companies, and most of them come in and they don't even want to talk. They just want to sit in my recliner chair. Do you know what a Calgon bath is? I think you girls or guys are probably too young. There used to be a Calgon bath where an ad, and I'm going to take a Calgon bath and go away and be taken away. It was really great. Anyway, we call my chair the Calgon chair because they just want to sit in the chair and they just want a whole week to be taken and lifted off of them for their stress. So, and then they come in with all kinds of different problems. So that's why I have to be like a detective. And I have to listen and they go, okay, this week, I never know what they're going to talk about. So that's why I have a lot of different modalities that I work with the Reiki and the relaxation. And I studied with a Native American healer for a long time and learned different ways of, it's called smudging. Has anybody ever heard of smudging? And that's to clear the space.
Done that with me before. I liked it.
Yeah. It's really, really helpful because we get energies around us. There's some people that are called empaths. So that's the other thing in the medical community. A lot of us are very intuitive. And because we're caring people, you're caring people, all of you, if that's what you want to do is be in the medical community, you want to help. And so that means that you can take on a lot of other people's problems. And then you start to get ineffective and depressed and you wonder why am I feeling like this? And I've had to work on some cases of medical professionals that I've had to clear off with that smudging and have them feel better again. So what I tell my people is, for anybody, that I ask the Holy Spirit. I love to work with the Holy Spirit. It's so powerful. I ask it to come in and just put a circle of light around me and protection around me, and anything that's negative just go off and go out to the heavens. So it's good to learn protection. It really, really is. To answer to I got off on a timer about protection. Yeah.
This might be a little off, but I've seen like videos on like the internet of like people like casting like demons out of people.
Oh.
Is that something that like you're familiar with at all or like do?
I have. That's what smudging is. That's what smudging is it gets entities off of people.
Okay, I just wondered if that was something that you did.
That's why you call in the Holy Spirit, or there's also a way that I use this. You bind anything in Jesus' blood and get it to leave, and it's a command from the heavens that it has to go. That's a good question. Does anybody have any questions about the questionnaire? Do you need it scored or anything? Did you figure out your percentages? What'd you get?
Physical 37, emotional 63.
Okay, does that seem to fit?
Can you go over what that means again?
Sure, yeah. Well, the physical is more outgoing, gregarious, what are you laughing at? That's not you?
No, it is.
Oh, it is you. Well, but still, I said we want to be some of each, and the other part with the emotional is holding your thoughts and your problems close to your vest, so you don't want to let everybody know your business kind of thing. But you can still be outgoing. Yeah. Does that fit? Actually, if you go to the HMI website, they have these tests on there. And it's really interesting. You can take it and they score it right there for you. You might want to just look at their website. They have so much information.
I need to do it. I can already tell you that they know all my business. I have no problem with that.
Right, right. Did you take this test or are you more,
I haven't taken the test yet.
you're probably more physical or right range? Yeah, yeah. Well, it's just a little indicator because you know that they say knowledge is freedom. And the more you know about yourself, then the more ammunition you have to be able to get along with different situations. Yep, that's right. Well, I've enjoyed speaking with you, and I hope that it inspires you to look into some hypnotherapy work. Yeah. Working with the mind is so, like I said, in regular therapy, like with psychotherapy or talk, they call it talk therapy. It's great for certain things, but they don't go that extra step and open up that pathway and actually take things down into the subconscious mind. So